Hi friends, welcome back to my channel. Today I am here with an explanation for an OED letter to a physiotherapist. It's the letter of Janet Craven. So before we write, we should know who is the receiver. So we should imagine ourselves in their position and should consider what all things should included in this letter. So let's look in detail. So the date is 5th December 2020. Usually they give the date of the exam date. Then where she was admitted, what is your position. So we will go to the patient details, name, age, then the social background, then family history. Then they are mentioning this medication history, the years and what all medication problems she has, the history she has. Then the current medication, she's on warfarin 5 milligram, aspirin 75 milligram, and lisinopril 20 milligram once daily. That is indicated for B-GHUD disease. So let's move on to the present complaint. She had 4 hours history of difficulty in talking and numbness and weakness on right side. Then otherwise she was patient or alert and oriented. There was only some aphasia. Then the vitally she was stable, only the BP was elevated 164 over 100, and her BMI, that means body mass index, is 32. That means she is obese. Then the tests were performed: CT scan, echocardiogram, and in the CT scan it was normal, and blood pressure is now under control. So we shall have to mention that one. So the diagnosis is transient ischemic event and admitted to neurology ward. Then thereafter she was started on inpatient physiotherapy. Then discharge date is 5th December 2020. Then what are the recommendations? So it's the plan right to physio. So the name is the physiotherapist is Miss Riley, a physiotherapist in Chesterfield Physiotherapy. That is the address given. So it should be relevant notes into complete sentence and do not use note form. And the words should not be exceed 180 to 200 words. So let's see how we can write this letter in an effective way. So there are two, we can first write the address or the date. So it means we can write here the physiotherapist name, Miss Jessica Riley, physiotherapist, Chesterfield Physiotherapy, 89 School Road. It doesn't mean we have to include all, at least 4 lines, that's enough. Then we go to the date. There are also different ways to write the date, but here I will show 05 December 2020. We have to write in the words December, or 05/12 2020. You can write like that also. Then you have to, don't forget to leave a line in between. It's always need to keep a line in between. Then the salutation, it comes as Dear Miss Riley. So we always use the surname if it's more than 17 years. So if it's less than, we can use the first name. Then we have to leave one line again. Then the reference regarding Mrs. Janet Craven. We can write the full name and we can use age or date of birth. So if it's here, I used Janet Craven, age 69 or 69 years old. Like that we can write in different ways also. So here first we have to write the introduction. So we have to think to whom we are writing. So it's a physiotherapist. So we have to make what are relevant and what is irrelevant. So we have to omit the irrelevant ideas which is needed for the physiotherapist. So we have to consider the model I would like to give is, I am writing to introduce Mrs. Janet Craven. As per the new criteria in the introduction, we can use the full name. So we can write Mrs. Janet Craven, who has difficulty in ambulation as a result of transient ischemic attack. Or you can write also who has diagnosed with transient ischemic attack, but the receiver is physiotherapist, so it is better to write who has difficulty in ambulation as a result of transient ischemic attack, requires follow-up physiotherapy and management. So we have to leave a line again. Next we go to the present complaints, how he was admitted. So Mrs. Craven was hospitalized with right-sided weakness and numbness which lasted for 4 hours. Then we can write on examination what all things we have found. So on examination, her blood pressure was found to be elevated. If you want to write the reading, we can write, but it's better to write a concise letter rather than a long letter. Then a series of investigations were performed which confirmed the diagnosis. That means the CT, echo, everything was done. That is why we are writing. A series of investigations were performed which confirmed the diagnosis. Therefore, she has been initiated with physiotherapy. So whenever we write a letter, there should be a flow. It is easy for the reader to read. It is better to write the introduction only 3 sentences. Then the other one we can use at least 5 paragraph. We can make 5 sentences each. So where we reach? So we have told them that she has been initiated with physiotherapy. So leave again one line. So next we have to mention how is she now. So we can write currently Mrs. Craven's condition has improved, but still requires assistance. So we can write however, she requires assistance in mobilization. Then we are going to the past medical history or social history. So we can write Mrs. Craven has had hypertension and pulmonary embolism since 2010 and 2017 respectively, for which she is on medications. No need to mention what all medication she is taking because it's physiotherapist. He is not dealing with the medication, but he should know the hypertension and pulmonary embolism because while giving physiotherapy there can be a chance for hypertension or pulmonary embolism. We should take precautions while giving physiotherapy. That's why we have to inform the physiotherapist regarding these conditions. So again leave another line and we just go to the recommendations. What are the recommendations on discharge? So considering the above or in view of the above, it would be greatly appreciated if you could provide rehabilitative care for Mrs. Craven in order to improve her muscle strength, flexibility, balance and coordination. So it's mentioned what are the things we want to provide for this patient. Then we can write as a conclusion, please do not hesitate to contact me if you have any queries. So if the name is given for the receiver, you can write yours sincerely. And for viewers, the capital I should be capital letter and small letter, then comma, leave again one line, then you have to write register nurse or charge nurse, or if it's your name is given, just write your name. Okay, always try to write it legible and concise so it is easy and there should be a flow. So all of my friends, I think you like this video. Just subscribe it, like it and share it. Thank you.